In our checkup this morning, COVID-19 hospitalizations are ticking up again in the U.S. Hospital admissions began increasing in early July. For the week ending July 29th, hospital admissions increased about 12% from the previous week. And in New York, COVID cases were up by 55%. Dr. Corey Hebert with the LSU School of Medicine is here to talk to us more about this. So we're not out of the woods yet. That seems to be the headline here.
No, we're not. And we've really never been out of the woods. I mean, right now, people are not getting their boosters. We know that. People think that it's over. Our waning immunity is starting to show. The summer is so hot, so people are indoors, unlike, other summers where the temperatures weren't as hot. And so right now, we're having a real problem. And the bigger issue here is really not just the fact that people are getting COVID, because we know that it's not going to be as bad. The new Eris variant is not going to be more transmissible. It's not going to be more deadly. But the issue is that we don't know about long COVID at this point. And don't get me wrong, Eris can kill you. Let's be very clear. You can die from COVID-19 at this moment if you get it, but the odds are going to be kind of low. But but we don't know what's going to happen once you have had COVID 3 and 4 times. This is a neuro issue. This is a vascular issue. This deals with the brain. This deals with the spinal cord. This deals with your blood vessels. It deals with hypercoagulability. Who wants all that? You can't even say that fast. So the point is, we don't want you to use my old mantra of wash up, mask up, separate, and vaccinate. That's a tough one to still do right now, especially because everyone is out doing what they need to do. But what I do want you to do is please wash your nasty hands. I need you to do that. I need you to try to stay away from all these large gatherings where we know that people are spreading COVID-19 like crazy. And I do want you to be a little vigilant about making sure that your family members that are immunocompromised, or your family members that are over the age of 65, 70, your young children, we need to make sure that we're vigilant about folks not getting this, because it's just not good to have. And everybody knows somebody out there right now that has COVID, and everybody's trying to act like, shh, don't say anything. We don't want to get everybody worked up. But it is what it is at this point.
Right. Wash your hands, right? It gets down to the basics. What about home testing? Are you still recommending, or other medical professionals still saying, if you're sick, you should be testing so that you know you have it and you should approach your day and week differently?
Yeah, well, I think that's a good thing. I think home testing is great. The problem is that you're going to have to buy your own home test now, because the federal government, they're not giving them to you anymore. And people don't want to spend their money on that, especially with the economy kind of being a little sketchy right now. So the issue that I want people to recognize is that if you start having symptoms and you think that these symptoms are similar to what you had when you had COVID, I think you owe it to your community, you owe it to your family to test yourself and see if you do. If you do, you should kind of stay away from them for about 5 to 7 days and kind of be by yourself, catch up on your movies, because you just don't want to have this out in the community. It can cause death. And like I always tell folks, something could be rare. Death might be rare at this point. I'm not going to go that far, but let's just say death would be rare from COVID-19 at this point. If it happens to you, it's 100%, just like somebody wins the lottery. You don't want to be that person that gets COVID and dies as the same type of odds,
Yeah, agreed. I want to get your thoughts on one more health topic here. Researchers found a sizable amount of older American women are potentially overdiagnosed with breast cancer. That means that they may be getting unnecessary treatments. The study says overdiagnosis is when doctors find breast cancer on screenings that never would have become clinically apparent. So the cancers are real, but I guess they lay dormant in the body. Boy, this seems like we need some important messaging here, because you want people to go get checked. What are your thoughts?
Yeah, so that group age 70 to 85, that's a real scary group, because they're the ones who are overdiagnosed the most, right? And as you get older, you start not being able to pay a lot of attention to some of your body's signals, right? So you got to think about, we don't even have a lot of good guidance on whether you should even get a mammogram over the age of 75. But what I tell you women all the time, and not just women, let me be very clear, men as well, right? Because Shaft, actually, you remember Shaft? Shaft actually had breast cancer. So if Shaft can get it, anybody can get it. But the point is, you have to be very careful, because self-breast exam, I think, is very important. People try to poo-poo it like it's not that big of a deal. You know your breast better than anybody else knows your breast. And you also, because you're getting CT scans, MRIs, PET scans, we're picking up all these little tiny things. Please talk to your doctor so that you can say, look, is this an aggressive form? How long do I plan to live?
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.